say thank you to everyone who is joining us this evening. We are here to talk about COVID-19 and some of the updates that we have to offer. So we had an update in March, but as you know, a lot has changed. And so we want to make sure that you have updated information, and we have some new friends with us this time, but we're gonna get it kicked off. Oh, you guys may want to know who we have with us all together, but we have Dr. Julian with us from the Peninsula Health District and the Virginia Department of Health. We have with us Congressman Scott, who represents the 3rd Congressional District here in Virginia, Mayor Price with the City of Newport News, and Dr. Healy with the Northam Administration that deals with all things workforce and hopefully small business as well this evening. President Conley and Dr. Fisher, both from Sentara CarePlex, and State Superintendent James Lane here with us to talk about education. So we're gonna get it going and kicked off, but if you have comments, Tempest is looking at the Facebook page to make sure that we get all of your questions. So go on and put your questions, and then at the end, we've set aside some time strictly for questions, but you can go on and enter them now. So Dr. Julian, go on, take it away.
So good evening, everyone. I really appreciate people joining us in. Since the last time we talked, we have made remarkable progress, I think, in the battle against COVID-19. Back then, we were talking about bending the curve, and I think with the measures that have been put in place and the cooperation that amazingly good cooperation from the community, the citizens, we have significantly impacted the number of cases that we would be seeing. We've also improved our testing capability since the last time we talked. Even though we're not quite where we want to be, we're much better off than we were before. The one thing that hasn't improved as much as I would like to a great extent is our availability of PPE as personal protective equipment. However, many of the health systems have come up with unique ways to reuse and re-sterilize these materials. At this point, we are improving, and I think the last thing I'll say is that we do not want to quit doing what we've been doing, because what we've been doing is working, and that's the social distancing, hand washing, and all the things that we've put in place. So I'll stop there. I just want to congratulate everyone for having done a very nice job together combating this virus.
Awesome. Thank you, Dr. Julian, and thank you all for everything that you all are doing. I know that this can't be the easiest, but you're helping us get information and really putting out there what it is that we're supposed to be doing to keep ourselves healthy and to, of course, take care of others. Now we'll hear from Congressman Scott from the 3rd Congressional District. Congressman Scott.
Thank you, Delegate Price, for your hard work and dedication and bringing us together so we can discuss these important issues. Congress has recognized that we have an emergency and that it's having a disparate impact on some communities. We've, rather than dwell on the problems, we've talked about coming up with solutions. And the major part of the solution was the CARES Act, Coronavirus Aid, Relief, and Economic Security Act, which we passed about a month ago. We added some more money to it last week, and we passed legislation about a week or two before that. If those bills focus on education, paychecks, and healthcare, on education, the first thing we recognized that when schools started being closed, the young people are going to be out of school and they're not getting their school meals. A lot of students get most of their nutrition from the school meals, and we provided funding and waivers to make sure that these meals that they would have been getting in school could be provided at home. The school systems can do this because they do it every summer, and we just made sure that the children got fed. We provided a significant funding for K through 12 for things like cleaning the schools, technology and training in technology, and higher education. Half the money in higher education has to go to supporting the students. The other half recognizes the fact that colleges and universities are trying to maintain their campuses without students on campus. We also provided an extra amount for minority serving institutions like HBCUs, and that's done well. We gave support for those paying student loans. They gave them the ability to not pay for a couple of months, and the interest does not accrue during that period of time. We provided funding for childcare and Head Start. We know a lot of students are not in school, and so the early childhood education, we wanted to make sure that with, we need to make sure that the childcare system for essential workers would be there, since a lot of students aren't at home. A lot of people are taking their kids from childcare, and a lot of them were closing. We wanted to make sure that they were open for our essential workers. The main part of our legislation was protecting paychecks, making sure that all of the problems occur because you've lost your income. Can't pay rent, can't buy food, can't do this, that, and other. If you can maintain income, a lot of problems would be solved. $1,200 for every adult, and $500 for every dependent child under $500 for every dependent child under 17. In addition to that, for those who lose their jobs, we provided an additional $600 over and above what unemployment compensation would pay, $600 over and above what unemployment compensation would pay. And for most workers, that would make sure that they get about at least what they were making. In some cases, even more. We also expanded unemployment compensation to cover people who traditionally did not get unemployment compensation, like independent contractors, gig workers, and people like that. We provided sick leave, 2-week sick leave for small businesses have to provide it. They'll be reimbursed by the federal government, and also paid leave if you have to care for a child out of school. You can get paid family leave. The federal government will make reimbursements for that. Small businesses, in terms of paychecks, if you're continuing to pay your people, paycheck protection plan, you can borrow money. And if you use it for payroll, you don't have to pay most of it back. That was so popular that we had to come back and refill the coffers, and we understand they opened the portals back up. We understand that the computers have crashed. Healthcare, we provided free tests and free vaccines, but the next go around, we have a number of things we're looking at. Just very quickly, we need to put more money in the state and local. Last week, you had to adjust the budget. All the money we put in education, Norfolk State itself lost $100 million in construction and other things. We need to make sure we backfill state and local, and I think that's on the top of the agenda for the next go round, so that the money we put into education will be over and above. We need to have Cobra payments. If you lose your job, you lose your insurance, but you can keep your insurance. All you got to do is make your payments. Well, if you lose your job, you don't have the $1,000 a month that it would cost to keep a family policy alive. We need to continue subsidize those payments. We need OSHA to come in with enforceable regulations to enforce, to protect workers against airborne diseases. Not just healthcare workers, grocery store, meat packing plants, prisons, postal workers, everybody we have found senior homes where these things have been prevalent. We need OSHA to come in to protect the workers, and we also have to have family leave. There are a lot of things, and probably another round of $1,200 checks. There's a lot we're working on, and we expect another round sometime in May. But we're going to get through this. But people who have suffered so much need the kind of support that we're giving them. So thank you, Marcia, and look forward to the questions.
Awesome. Thank you, Congressman Scott. And so now we are going to go to the local level, and we're going to hear from Mayor Price from the City of Newport News. Mayor Price.
Thank you, Marcia. We appreciate what you're doing to keep us posted on what's new in development about this disease that is spreading and affecting us so terribly. You know, I'm just going to highlight some of the new things since the last time we talked. But of course, all of our city offices and facilities and buildings remain closed to the public. However, we are still maintaining work, and our essential city services are continuing. Of course, all city-sponsored events, programs, classes, and activities have also been canceled. But on the brighter side, tomorrow we're going to convene a recovery planning team to discuss phased opening of facilities and offices. This includes developing policies related to physical access and interacting with the public, identifying PPE needed for staff, and evaluating facility modifications needed before opening. This could be stuff like plexiglass in the reception area, social distancing markings, and signages. So that's just so that when and if we, when we do get to that phase, we will be prepared for that. Of course, one of the things that a lot of people are concerned about, we get a lot of calls about, are the homeless. Four Oaks Day Center service is closed. However, we still twice a day, 7 days a week, regardless of the weather, our team travels throughout the city delivering food and supplies to the homeless, where we know homeless people congregate and find shelter. This, in addition to food, we deliver hand sanitizer, soap, sleeping bags, blankets, and more. And we also coordinate with the Salvation Army and Link as well. So we also, help them with medical providers. We have mobile showers and laundry services. That's every Wednesday and Friday between 8:30 and 11:30 at the Four Oaks facility. Beginning this week, also something new, we're going to have take-home dinner meals will include in our Meals to Go services on Tuesdays, Thursdays, and Fridays. And this is thanks to a new partnership with World Central Kitchen. And actually, due to Marcia's contact with them, we were able to make this happen. They teamed with our human services, and we've been able to set this up. And I think this is going to be great. People are going to be looking, because the food is really good as well. The city is hosting a Facebook Live this Thursday at 6:30 with the Newport News Public Schools. So you could hear Dr. George Parker, Superintendent, as well as Dr. James Pohl, Chief Academic Officer, if you have any questions about schools that I may not be able to answer as well. So I'll stop right there and look forward to any questions that we may have.
Awesome. Thank you, Mayor Price. And you can also, to find those meals and locations, you can text food or COMIDA to 877-877. I just did it to make sure it still works, and it does. It'll ask you to type in your address, and then it pops up with several locations for where you can find those meals for students. So thank you, Mayor Price. Now we're going to kick it over to Dr. Healy, who I forget your long title, but is in the Northam administration and does all things workforce and small business. And so we're looking forward to hearing updates from you. And if you could tell us your full title so that I won't do that again. Thank you, Dr. Healy.
No worries. Thank you so much, Delegate Price, for having me on this Teletown Hall. And you have a fantastic STAR team right here, and I'm excited to be part of it. I am Governor Northam's Chief Workforce Development Advisor. It is a long title. I sit in his cabinet. And so really what I do is all things workers and workforce. And so the workforce part really during this COVID-19 challenge is looking at healthcare workers, potentially if there's a surge. Our priority now is making sure that we have enough staff in our long-term care facilities, and then backfilling any other staff as well through volunteers or our bridging programs. We have new training programs specifically to long-term care facilities. Thanks to Congressman Scott mentioned, I do safety in the workplace, and I really appreciate his leadership thinking about that we have many Virginians that are scared to go to work in this situation, and that we have to have appropriate standards to make sure that we can enforce them, the government can enforce them, to make sure people are safe, because in a couple of weeks, people will be going back to work. We've received over 6,000 complaints about workplace safety, and we want to make sure that we're providing sanitation and proper rules and regulations as well to all different types of industries. We do have a team. It's a business team. We're working with over 30 types of business types, from it's like King's Dominion to restaurants to beauty salons. What are safe ways that we can reopen businesses in Virginia? And I think it's really important, not just for the business sake, but the consumer sake too, that we want to feel safe in these different environments. And then the third piece I oversee, and thanks again to Congressman Scott, is all things Virginia Employment Commission. And that is that we have over 500,000 Virginians now on unemployment insurance. We've never seen these numbers ever. That is, think about what we did in the first 3 weeks of COVID-19 was more than we did in the last 3 years of claims, for unemployment claims. And so my job is to making sure that we have streamlined processes, that our online portal is working. And now we have 2 portals. We have one for anyone who's on regular unemployment. And then if you're the independent contractor gig worker, you have to go through that first portal, and then you get kicked to the second one. And that's where you have to upload your documentation and get your benefits. And I also really appreciate the extra $600 per week until the end of July. It's really helpful, because this is a scary situation now. We know Virginians are scared of their health and their safety. The last thing they need to be scared of is really how they're going to pay rent and get food on their table. And so these extra unemployment benefits are fantastic, because we want people to stay at home and not worry, and that's what it is. There's also extension of benefits to 39 weeks as well. And so I can answer any of those questions on workers or workforce issues.
Awesome. And Dr. Healy, can you tell us if someone wants to find out if they're eligible either for the small business loan or for unemployment, where can they go for that?
Sure. For the small business loan, I can also thank you again to Congress for expanding the Paycheck Protection Program. And that really, in the end of the day, we rather people stay on payroll of businesses and not go to unemployment insurance. It's helpful for benefits as well as, so those are through the SBA. So you can go to SBA.gov, and there's coronavirus, and it shows you where you can look at your local bank if you're already not banking, that you can get the SBA loans. And the portal I hear is down, but it's back up as well. And then the unemployment for Virginia, you have to specifically apply in Virginia, is vec.virginia.gov. And if you even think that you qualify for unemployment, we have really expanded eligibility, and eligibility does change by the hour. Independent contractors, anyone who's related to the workforce in the last year might qualify. So it's worth trying. So that's at vec.virginia.gov.
Awesome. Thank you so much, Dr. Healy. And so now we are going to hear from, first, we'll hear from the president of Sentara CarePlex Hospital, Kapua Conley. Kapua, you there?
Hello?
Hey, we can hear you.
Okay, I'm going to punt to Dr. Fisher.
Okay, sure.
Okay.
Dr. Fisher?
Dr. Fisher's got to unmute.
Dr.
All right,
Fisher?
good. Well, thank you, Dr. Price. Yes. So as you can imagine, we've been really busy at CarePlex over the last several weeks, and I do want to say right off the bat a couple things. We're really, really proud of our nurses, our medical staff, hospital staff, our physicians here have really done a fantastic job rising to the occasion during this crisis, and also the community. The support we've seen from the community has been phenomenal, whether it's donations of much-needed medical supplies or food, or just well wishes. Really, really, really appreciative. And I will say that although we've been managing the patients that we're seeing at the hospital well, we are looking at prediction models as far as what we can expect going forward with this COVID pandemic. And we're using what's called a Penchime model, which is a forward progressive-looking model that is showing that we could potentially be seeing cases well through the summer and potentially into the fall. So with that, we need to plan for it, because as we're looking at that as a new normal, at least for a short term. We need to care for patients not only that have COVID, but patients that don't have COVID. And one of the issues we've had to work with is delaying surgeries for patients. The emergent surgeries are going through and have continued to go through, but there are cases that needed to be delayed so that we could appropriately allocate PPE and also repurpose staff to treat the potential COVID surge. But now we're at a point where we need to, based on the governor's direction, move forward with treating these patients that we have delayed. Of course, we have to do it in looking at our PPE, making sure length of surgery, looking at that, need for nursing facility, et cetera. Sentara has been able to increase our testing capacity for COVID, so we're doing what is called Pcr testing through our central lab in Norfolk and also in Northern Virginia. This has allowed us to test patients in a very expeditious manner so we can get a nice turnaround time, but it's also helped to offload some of the capacity from other testing facilities in the area, and has allowed other healthcare systems to get tests back within 48 hours rather than the 5 to 7 that we were getting before. We talked about the heroic medical staff and providers that we have here at the hospital, and one thing that's important is keeping them safe. And we're very proud that although PPE is scarce, Sentara's done a nice job allocating it, and also making sure that our staff have the appropriate PPE. We do that based on CDC guidelines, but also that when we look at our numbers as far as staff exposed and staff that have contracted COVID, secondary exposure, we're at about 1% of our total staff, and around the country you'll see rates of 10 to 15%. So we're really proud of that, and proud to keep our staff safe. So with that, I'll close my conversation and welcome any questions.
Awesome. And Kapua, did you want to add anything to that?
I just kind of piggyback what Dr. Fisher said. We initially, in our initial web Zoom conference, we had talked about, like Dr. Julian said, bending the curve, and our major concern was running out of capacity in the hospitals and possibly looking at alternative care delivery sites. We heard about the Hampton Roads Convention Center. We also looked at potentially Port Warwick. Now that we've seen our numbers drop, I think we feel like we're comfortable with what we have as far as our facility layout and a potential surge, us being able to handle inside the walls of the hospital. But like Dr. Fisher said, although we think our peak is going to be lower, it's probably going to be extended out for a very long time. And so we're going to have to find a way to manage both the COVID pandemic and everyday needs of the hospital and caring for our community. So we're kind of in uncharted waters here, but I think I'm confident with the team that we have here and the support structure we have with Sentara, we'll be able to meet the demands of the community.
Awesome. And Kapua and Dr. Fisher, one question that I've been getting was about what if people are feeling symptoms of other things? Like they don't feel like they have COVID-19, but they're sick and they're scared to go to the hospital. I know that there was some discussion with that with Governor Northam's press conference today, but starting I guess Friday, can you give us some feedback on should people go to the doctor if it's not COVID related? Is it safe to go to the hospital for other things? Can you talk about that a little bit?
Sure, absolutely. Yeah, I mean, as you can imagine, we're taking multiple precautions to keep people safe to come to the hospital. We want people to know that it is safe to come. Please don't delay, treatment if you're feeling unwell. We do want you to come to the hospital, do want you to be seen. One example is as we're preparing to do some of the delayed surgeries, we're actually testing patients 48 to 72 hours beforehand for COVID. We're also screening them for symptoms of COVID and asking them to quarantine beforehand. As far as folks coming to the emergency department, all of our staff are masked, all wearing eye protection. We are also offering what are called coupon masks to our patients coming into the ED for their own protection and protection for our staff. And coupon mask is a copper impregnated mask that actually inactivates viruses within 30 minutes to an hour. It is a cloth type mask. We do screen all patients that come into the emergency room with the screen questions as far as cough, shortness of breath, and fever, and take all CDC recommended precautions.
Awesome. Thank you for that and for reassuring people that might need to go get treated for other things. And our last speaker, last but not least, is State Superintendent Dr. James Lane with the Virginia Department of Education. Dr. Lane?
Thank you, Delegate Price, and thank you for having me this evening. I'm excited to be a part of this esteemed panel. We've been hard at work at the Department of Ed, working with our local school districts to continue a continuity of an array of services. Immediately after Governor Northam ordered that all schools were closed for the remainder of the school year on March 23rd, our school divisions were focused on a variety of issues. First and foremost, making sure students were fed, as Congressman Scott mentioned, and I think our school divisions have done a great job with that. So one of the things I want to say is to all of the cafeteria workers out there and bus drivers that are delivering meals and everyone that's a part of that on the front lines, just a huge thank you, and know that we think you're a hero. Then we really turned our focus to how we would make sure our students that were on track to graduate could graduate, how students would be promoted to the next grade level. And so we issued guidance on graduation and continuity of learning, and we actually put together a task force that put together a report called Virginia Learns Anywhere, which was our plan for how to educate students during the school closure. And so if anyone wants to see any of the guidance I'm talking about, you can go to doe.virginia.gov /COVID-19, and there's probably 20 or 30 guidance documents we've listed there. But the most common question I've gotten is, I have a 12th grade student, they were getting ready to graduate, are they going to be able to graduate? And the answer is yes. If they were on track when schools closed originally on March 13th, then certainly there have been a number of waivers issued to make sure that requirements were handled for our seniors. So a huge thank you to the General Assembly and Congressman Price. They passed the budget last Wednesday, which gave us the opportunity to enact those waivers, and we started that process immediately and issued a release on that on Friday. We've also required a number of waivers from the federal government, and so again, a huge thank you to Congressman Scott. We were able to issue those waivers as well. And so, as I'm sure you can imagine, there are federal rules for education, state rules for education, and local rules for education. So it took us a huge project to get all that delivered. And then, one of the questions you may have is, well, if my student wasn't on track to graduate, can they still graduate? And the answer is yes to that as well. We've asked our school divisions to continue to work with students who either weren't passing their classes or hadn't enrolled in everything they needed, and have encouraged them to move forward on that. And then for students that are not 12th graders, we issued some of the same guidance. Our expectation is that if students were passing their grade level on March 13th, that they be promoted to the next grade level and to the next series of courses. If students were not passing, we've also asked our school divisions to work directly with those students to get them to passing and fill in any of the gaps that they need. We've started talking with our school divisions around a number of scenarios, because unfortunately in Virginia, there are some students that don't have the internet and are part of populations that some school divisions will struggle to reach during this time. And so we laid out options, including extra summer learning, embedding learning into next school year, adjusting calendars. And so our school divisions are hard at work in making those plans. As part of continuity of learning, it is our expectation that new learning continue. And our expectation is that if new learning continues for any student in your community, it should continue for every student in your community, especially students with disabilities, ESL students, students without the internet. And so our schools have been really creative to come up with a number of solutions. For students without the internet, we see packets going home, sometimes delivered with those meals that we mentioned earlier. And it's just been exciting to see our educators wrap themselves around their students at this time. We've worked hard to ameliorate some of those equity issues. We announced a few weeks ago that Virtual Virginia, which is our virtual learning platform, is now open to every teacher and every student in the Commonwealth. You just have to work with your school division to get signed up for that. We partnered with WHRO right there in the Hampton Roads area, and they are now doing 2 hours of instruction every day on public media. They're doing primary grades from 1 to 2 o'clock. They're doing some high school courses in earth science and algebra from 2 to 3. They're launching their advanced placement week this week to prepare students for the advanced placement test, and they're making plans to expand to additional grade levels and others. And so next week is Teacher Appreciation Week. So if you get a chance, make sure you thank our teachers for everything that they're doing. Our teachers went from loving and caring for our students in person to standing up remote, distance, or virtual learning in a matter of weeks. And it's just been really impressive. I can go into way more details about the work that's going on, but again, a huge thank you to Congress, a huge thank you to the General Assembly, and to all of our school districts, teachers, and staff members for everything that they're doing to take care of children at this time.
Awesome. Thank you so much, Dr. Lane. I know that it's been quite different for each one of you in your respective areas and just dealing with this, I guess, new norm as people are calling it, but particularly with making sure our young minds are still stimulated and active, and that we're trying to work against any achievement gaps because they're stuck at home through no fault of their own. So thank you all for that. I wanted to add just a few updates of my own. As you all know, on Wednesday, you might have seen the pictures, but we were under the tent for the House. And we had our reconvene session. And so it was really kind of interesting to see all of the bills and things that we were able to make some adjustments to. But it was really important to understand that we could have no new bills and no new laws there on Wednesday. It was just in response to the governor's vetoes and amendments. And so there were some creative things that we did in order to address some situations, but we are probably going back in the summer to finish the budget. So a lot of the new spending was put on pause, much like Congressman Scott was talking about, as far as like the money, you know, it's just, we don't know what the budget is going to look like. And so some of that new spending was put on pause, but we did finish that work. And so one of the things that I know you all have heard me talk about, been pretty vocal, was about whether or not the elections would be moved. And so the House approved for the governor to move the elections to November, but the Senate rejected it. And so then the governor was only left with one option, and that was legally the governor could push the election by 14 days. And so that's what he did, but that was all he could do. That was the limit of his power. So those elections were put to May 19th. I will tell you that scares me a lot. And so I know that we are hearing good news and we're hearing people talk about plans to open things up, but I think they're just plans right now. We weren't really intending to send thousands of people out into the streets that early. So we would love for everyone to get an absentee ballot. If you can, ask for your absentee ballot. You have until May 12th to request your absentee ballot, and then you have until the 19th, which is election day, to do that. So I want us to focus all of our efforts to make sure that all of our loved ones in areas that have local elections, especially Newport News and Hampton, that we get those absentee ballots so that we don't have lines and lots of folks out at polling places, because we're still trying to do our social distance thing. And so I also just want to say a general thank you to everyone on the front lines, whether you are working in the grocery industry, you're delivering for Grubhub, whether you're healthcare, whatever it is. If you are, and when I say healthcare, I mean doctors, nurses, Dr. Fisher, everybody that works in your building, right? and janitorial staff, custodial staff, everyone that is making sure that that folks can still keep our community safe, but at times they're putting themselves at risk. And so I don't have a parade for you, but I do have a promise that I will continue to fight for better policies for you. So that is what I can offer. And then on May 21st, we're going to have an in-depth look into some of the new laws that were passed that will become law and take effect on July 1st. And so look out for that. That's on May 21st. And so I definitely want to say thank you, but we do have a couple of questions. And so now we want to get into that period and really dive into that. And before Tempest takes over from the Facebook ones, I've gotten some in by email. And so Congressman Scott, the number one question that we have gotten is, where is my money? Can you speak to that?
There's so many different streams. I'm not sure which one they're talking about. There's a $1,200 stream. If the IRS had your bank information, you should have already gotten it. They're beginning to mail out checks now. They should have started going out, but they'll take a little time. If there's a question about dependents, they might have had your information, but not your dependents' information. There was a deadline earlier this week that you had to sign up to list your dependents. We're trying to get that deadline lifted so that people can put in their dependent information. There's also the small business loans. That's like I said, ran out of money, and we passed some more money for that program, and the computers are crashing. The last time we checked earlier today, so many people are applying. So it depends on which money they're talking about. Most of them are talking about the $1,200, and most of the people should have gotten that. The unemployment compensation money, Dr. Healy can talk about that as to how long, if you apply for unemployment compensation, how long will it take to get the money, and whether the federal money has actually started coming in yet. Megan, can you take that part of it?
Sure. For unemployment, if it's pretty streamlined, you check the box lack of work. We have your information in our payroll system because your employer paid into it. You're an employee of an employer. You should get your benefits within a week if you apply online or go through. If you have to add any other documentation, it takes that maybe additional week. And then last week we opened the Pandemic Unemployment Assistance Portal, and that's for gig workers, independent contractors, sole proprietors, and that you have to post all your documentation, tax records, profit loss statements. You will even take a letter from an accountant about what potential income you had. Last week is when we opened that. We had over 60,000 people apply. Hopefully we'll be getting out those benefits at the end of this week if all your documentation is in line and it's been approved.
Well, see,
Awesome,
I think Megan did point out that the volume they're dealing with is totally unprecedented. Nationally, the record was about 600 and some thousand in a week. We had 1 week with 3 million, 2 weeks with 6 million, 1 week with 5 million. No computer system should have been able to keep up with this volume. And so they're doing a great job. Keep it up. If they can get it out in a week, that's just extraordinary. So Megan, thank you for your hard work. Keep it up. People need the money.
And then also I want to keep with you two as well. We've gotten a few questions from 17-year-olds themselves and from parents of 17-year-olds. And so we had this situation where the 17-year-olds have jobs, but they don't file their own taxes. And so they weren't able to be claimed as a dependent to get stimulus money, but they also couldn't claim it for themselves. Is there anything coming that might address 17-year-olds, especially a lot of them kind of do their own thing, and they're helping add to the income for the family?
The dependent under 17 was a measure that was in several other statutes. I tell you, one group that really got busted on that were students. College students didn't get the $500 from the parents, couldn't get it on their own because they were dependent. Next time we go through this, I think we may make an adjustment on that. But if they're in that glitch, they won't get any money this go round. We'll try to do better next time.
And so, Congressman Scott, we know that you are the chair of the Education and Labor Committee. And so we know that you sound like you understand that. Is there anyone else that these 17-year-olds that have lots of time need to call, and maybe they can be active in trying to get that fixed?
Well, you only have one congressman, so if they want to express themselves, they can call my office. But we're going to be working on it to try to fix that to the next go round.
Okay, and just a reminder, you do have two United States senators, Senator Mark Warner and Senator Tim Kaine, that you can also talk to, because any bill that passes the House or the Senate has to pass the other body as well. And then one last question that I had, and I'm sorry, Congressman Scott, this might be back to you as well, but some college students, their ears kind of perked up the last time that you said that there might be money coming for students. How do they go about getting the money that was to be for them?
The money went to the colleges. We said half of it had to be spent on students. Colleges were buying airline tickets so the students could go home if they didn't have, once you tell them to leave campus, if they don't have any money, they can't go anywhere. So they were buying bus tickets, airline tickets. Some had no place to stay, and some were homeless to begin with and were just on campus during the school year. If you close the campus, they're in problems. So if we didn't put any much direction on it, it's up to the college to decide, but it has to be spent on students. Some are using it for refund. I imagine using it for refunds, but if they're continuing the education, some of the students may need computers, but it's just to help the students, and each college has to figure out what they're going to do with the money individually.
Awesome, thank you. And so now we're gonna go to Tempest for questions from Facebook Live.
Good evening, everybody. So we have two questions so far. The first question is from Ms. McCaskill. She would like to know, and I know this was touched on a little bit a few minutes ago, but she would like to know if a person is receiving unemployment benefits now, do they also qualify for pandemic unemployment assistance?
I think that's the $600, which if you're on unemployment, Megan, you want to take that, because if you're on unemployment, you'll get the unemployment plus the 600. Megan.
Yes, and so anyone on unemployment, that's if they're employee under employer, they should get the $600. And then the pandemic unemployment assistance, they all sound pandemic-y, all these terms. To be honest, I get confused too, but the pandemic unemployment assistance program is for really, we call it the gig portal for gig workers, independent contractors. We'll look at your income, we'll look at your tax records, and then add the $600 on top of that. So everyone should get the $600, and then your formula is up to $378 per week plus the $600, and that's based off of your income.
And this is the first time that we ever included independent contractors or gig workers. As Megan indicated, if you are an employee, your employer pays into the unemployment compensation fund, so they have all the records of your income. There's nothing to prove. You're just out of work. They just run the computer. They know how much you're making, so they know how much you're entitled to for unemployment compensation. Independent contractors, gig workers don't pay that, so that's why they have a much more complicated. So they usually haven't been eligible for unemployment compensation to begin with. Making them eligible makes the workforce, the Employment Commission life miserable, because they have to start from scratch. It's very labor intensive. They don't just press a button and send out a check. They have to actually evaluate each and every case individually to see how much the person is entitled to. It's much more complicated. And when you have a tsunami coming in of paperwork, it's a lot of work, and it's brand new work over and above what they were doing to begin with.
And just a follow-up to that, I just want to make sure that we reiterate. Dr. Healy, you said you may have been rejected earlier in the year, but go on and try. If you hear something maybe in the news that says you're eligible, go on and try. Is that correct?
Yes. What we're trying to do is, if you have been denied, we sent everyone a text message. We sent over 100,000 text messages 2.5 weeks ago. They say hold tight. We sent one out last week to say, hey, now it's your turn. Please go to the VC website. And so if you have been denied, all your information, even your bank account for direct deposit, should be kicked over to this new portal. And then that's where you go on and you upload your documentation. Yeah, I really appreciate Congress doing this. This is the first time we've ever done this. We did build a brand new system in state government building a system in 2 weeks. It's pretty amazing to me. My team works 24/7. Like every weekend I got calls in this technology. So there's probably only 10 states that have actually gotten this program up and running. And even Microsoft was on national TV telling the innovative Virginia story. So even though it's been hard, the phone lines have been clogged, the internet's been slow, I totally get it. But we're working as hard as we can.
And one last thing, so that just to make it plain, you may not be eligible for this pot of money, but you might be eligible for this pot of money or both. And so that's what you're saying with the two different portals?
No, you can't really qualify for both. The second portal is only if you've been denied for the first. But in the end, it's the same money. It's the $378 per week plus the $600 for up to 4 months. So it's one or the other. But I know it's weird. It's two different systems because a lot of people, we've had about 100,000 people get denied, and that's who got text messages to say try again. I tried the new portal. I think we're ready for you now.
Megan, gig workers are entitled to the $600. Are they also entitled to the regular unemployment too? Did Virginia change its rules?
Yes. Yes, it's part of the income formula, the formula they use, and then they add the $600 because that's the problem. So if we knew that every gig worker got $600, we could have cut those checks 2 weeks ago. It's building that base formula out of the 378. That's the trickier part. So they get the additional funds. Yep. And we actually, in Virginia, you will get back pay. I should tell everyone this. Up to March 15th, because that's when the governor closed down businesses. A lot of states are doing on CARES Act was signed on the 29th, but we decided since some people were out of work 2 weeks before that, you will get your back pay after you get your employment up, potentially all the way up to March 15th. There'll be a nice size check, probably not your first week because we have to make sure the system's up and running, but that second week is when we usually start back paying.
That's awesome. Tempest, are there any questions, any other questions?
Yes. So there's another question. Have you thought about hazard pay for direct care workers that are working directly with COVID-19 patients daily?
Yes, that's being considered for the next round. There are a couple of questions. One, who is endangered and therefore entitled to hazard pay? Is it hazard pay or essential worker pay? Because if you have to work, you are somehow endangered, even if you don't have exposure to the virus at work, you're not safely at home. And so we're working out who's eligible, how much, how they're going to get paid. But one point I insist that we continue to make is if you have an unsafe workplace, the solution is not to send people into the unsafe workplace and just pay them more. The solution ought to be to make the workplace safer.
Right.
If we have an enforceable OSHA regulation, there are things you can do. I checked into a hotel when I was in Washington a couple of days ago, and the person that checked me in was behind a plexiglass screen and was wearing a mask. That didn't cost that much. In a grocery store, you could require everybody coming in to wear a mask. You can have a little screen between the cashier and the customer. So little things you can do that OSHA can require to protect the workers. Now, there's some industries where we know there's a problem. Prisons. What are we doing to protect jail and prison workers? What are we doing in senior homes? We know these are problems. Meatpacking plants, other manufacturing plants. We know that there are problems in these places, and OSHA needs to step up, evaluate what the problem is, and issue a temporary or standard, emergency temporary standard to make that is enforceable. As I understand it, Megan could enforce it if OSHA authorized it, but they can't make up stuff. So OSHA has to step up and come up with an enforceable standard. Now, a standard protecting workers from airborne diseases has been pending for 10 years, and it's ready to go. So I mean, it's based on CDC recommendations, so they know what to do. But it's just a matter of getting serious about this and protecting the workers. And so the solution to the unsafe workplace ought not be more money, it ought to be a safe workplace. Having said that, yeah, we're working on additional pay for those workers, but we're also working on an enforceable regulation so that their workplace is actually safe.
Awesome. Tempest, any further questions?
Yes. How can someone apply for an absentee ballot?
Yes, so I will make sure that we drop the link, but one of the links that I have is bit.ly/Y OUR V VOTE MATTERS. Your VA vote matters, and that takes you to your citizen portal where if you are a registered voter, you log in using your name, your the city or county that you're registered in. I think it's like the last 4 of your social and your date of birth. And then you'll see your information. And then there are 2 check boxes that you can do in the middle. And one is apply for my absentee ballot. You'll click that box and then hit the green button right beside it. And then it'll take you to how to apply. Now, right now, because the new laws have not gone into effect yet, you still need to have an excuse to do absentee voting. And it is legal and okay to use the 7th choice. If you're doing it online, it's the 7th choice, but it's my disability or illness. You do not have to be sick. You do not have to have a disability, but you can legally, it's okay for this time, you can legally say my disability or my illness in order to get your absentee ballot while we're under this state of emergency. If you have any questions, Tempest and I will also drop a link to how to get in touch with us. But we ask that you all go on and get your absentee ballot now. Please do not wait until the last minute. And just remember, as soon as you fill it out, and as of right now, we have not waived the witness requirement. I know, but you still got to have a witness signature, and then get it back to your registrar as soon as possible. The other thing that we're working on that's not quite in effect yet, and maybe Congress can help us out for November, but this is not a postage paid return envelope, so you will have to find a stamp. Trust me, I'm millennial adjacent. I had to ask my mama for a stamp, but if you can get a stamp, send it back, get your witness signature. I know that we don't do a lot of mail, but it's really important that you do that and you do it in time so that you don't have to go in person. But in-person options will be available. And I've heard from the Secretary of Administration, Kiana Connor, that they are also working on how to make sure that the elections workers are safe and that voters would be safe should they choose to come in person. So that's May 12th.
One of the things we're doing is trying to appropriate money to help the election process. We were looking for 400 million. We got 100 million, but we need money to do things like help with the mail and help with training, help with possibly providing PPEs for poll workers, whatever the local election officials need to have a fair election. We don't want the situation like they had in Wisconsin, where the Speaker of the House of Representatives was standing there in full hazmat gear, telling at a polling place, full hazmat gear, telling the reporter, yes, it's safe to come and vote. I mean, we can do better than that, and we need to make sure that the polling places are safe, that the people are spread out enough, and that the process works. Now, I understand if you want to vote by absentee, you can call the registrar and they'll come downstairs and do curbside absentee voting for you, so that you just call the register, tell you in the parking lot, they'll come down and you can vote by absentee before the election. There's always been curbside voting at the polling place. You drive to the polling place, send a message out, and they'll come out and you can cast your vote and they'll take it back in. So people can have very limited contact voting, but it's important that everybody get out and vote.
So 2 caveats to that. If you've ever voted in Newport News and Hampton, you know that the average age of our wonderful elections workers is older than, or about my parents and older age. They are on the list that Dr. Julian has referred to as high risk. And so I do believe that there has been a call put out for elections workers that might not be high risk to help us fill the gaps. But also, I would urge you, if you can do a less than in-person option and you can do it by mail, please, to keep them safe. But by all means, I've heard stories of y'all walking around in stores without masks on. Remember, when you wear the mask, and Dr. Julian, you correct me if I'm wrong, but when you wear the mask, it is to help protect others. It is an act of generosity to keep your filthy germs to yourself. But that's not the scientific term. But if you do show up to a place, wherever the place is, but especially a polling place where you know people that are there might be on the high risk list, wear a mask. Dr. Julian, can you talk a little bit more about that face mask wearing and why it's good again?
Sure. You're exactly right. The real benefit of that is to keep the person who's wearing the mask from spreading the germs. And that's important for a couple of reasons. One, we are learning that there are a number of patients or people who are asymptomatic. They have no symptoms whatsoever, but they are COVID positive. And theoretically, they're able to spread the virus. And so when you take it upon yourself to wear a mask, you are helping others. I think the other thing is that there is some protection in the reverse way. It's not as good as an N95 mask or something of that nature. But it also, I think, reminds you not to touch your face. It's just a great reminder of why we're doing what we're doing. And there's no stigma to it. And, you know, it's the right thing to do.
Absolutely. And don't forget to turn some folks in for price gouging if they're doing that. I think the Attorney General wants to hear that. We don't want anybody exploiting folks as we're telling everyone to wear these masks, to be exploited for that. But thank you for that. And Tempest, I think you had a question for Dr. Lane.
Yes, I do. Will the teacher evaluation system be modified as we face the next school year, where we will likely have many students who are behind? And also, Ms. Simmons wants to know, do we have an anticipated date to start the next school year?
Thank you for those questions. We do not have a date for the next school year yet. We're going to continue to monitor the trajectory of the virus and make some decisions in the future. But what we are doing in the meantime is planning for multiple scenarios. We're planning for a scenario where we can have some summer school opportunities for the students that would typically go to that, and maybe others if the district chooses. We're planning for an on-time opening in the fall, and we're planning for the possibility that this could continue into the future, or as you've probably heard on the media, what they call the double spike, where maybe this could start to subside for a while and then come back. And so we're looking at all of that, but right now, no, we cannot definitively tell you when schools reopen. Certainly the governor's order right now is through June 10th, and I think as we get closer to that date, we'll certainly have more information on that. On the teacher evaluation system, as we head into the next school year, I think if you assume that we open on time, then the teacher evaluation system will continue as planned. But like we've tried to do with all of the situations that we faced here, as we work through this situation and see the realities of what this looks like and how it evolves and what date we're actually able to open, certainly there can be some modifications there. And you know, probably the question is coming with relation to Standard 7 and you know, what about student test scores and all of these kind of things and everything. Well, for this year, we have certainly waived all the tests. Thanks again to Congress with the CARES Act and the waivers that came from USED to make that possible. And we also, with the General Assembly's approval last Wednesday, were able to cancel the state-only tests for this year. We're now in the planning process for what next year will look like for all of that. And so I've launched 2 task forces. One is focused on what we're calling our recovery task force. That's just going to think about how school will open, all those type of issues that are inherent with when that happens, and what type of social distancing will be required in school. And certainly we'll do that hand in hand with the governor and medical professionals. The other task force that we've launched is our accreditation task force to think about not only assessment, but with the impacts of the coronavirus closures and other factors, how we can provide support to schools and think about our accreditation system into the future. So next school year, I think you'll see a lot of those task force reports start to come out with more information on that in the next month, probably 4 to 6 weeks. And then I think as it relates to this school year, certainly those tests are canceled. And then oddly enough, the decisions about teacher evaluations as it relates to teacher contracts are actually local school board policy matters. And so we've asked our school divisions to work directly with their school board attorneys to issue information in that area. But you know, broadly speaking, the testing component of that certainly should be waived.
Awesome. Tempest?
Okay, so we have two questions about testing. The first one is, when will testing sites be set up for people that stay in low-income areas?
I suppose I could take that one. We are actually working in conjunction with Sentara Healthcare. The organizational meeting is actually tomorrow morning to provide that on the peninsula. More details to follow. We do have a hotline phone number, and you can call into that, and I'll provide it to Delegate Price if she doesn't already have it. She can post to find out when that's going to happen. I don't know if Dr. Fisher knows any more about that since we're doing it with Sentara, but that is coming forward soon.
Yeah, I haven't heard of any testing collaboration presently.
But it sounds like it's coming, so that's
It is coming. Yeah, I was on a couple of phone calls last week with some of the folks at Sentara. I believe it's already happened over on the south side, and so we're looking to implement that here.
Awesome. And this question probably is from some announcements that were made at the governor's press conference today about more testing being made available to those that are in closer living situations like nursing homes, low-income housing, and jails. And as far as what Congressman Scott had mentioned about the meatpacking plant, there was a lot of discussion today about the Eastern Shore and making sure that there were services that were available in the languages that are spoken by the workers in the meatpacking plants. But if you can go to Governor@Virginia, that Facebook page, you can watch today's 2 o'clock press conference, and you can find out more information on that. And Dr. Oliver speaks to that testing capacity. And then also know, just a reminder, Monday, Wednesday, and Friday, 2 o'clock on Facebook, the governor gives updates with lots of his team members. Tempest, what was the second question?
All right, so the second question is it too early to open back up if we don't have good and widespread testing?
I think the short answer is yes. It's too soon. You know, there is a governor's task force. That's also talked about at the governor's press conference, and I would reiterate what the delegate is saying, that is something that everybody ought to be looking at every day at 2. But there is a task force. They're working on getting more testing. There's a greater testing capability, both with the state lab, with the private labs, and with VCU and University of Virginia. So it's coming. We're not there yet. It would be much better to have more widespread testing to open back up safely. That would be the goal.
Awesome. So what I heard, Dr. Julian, was stay home, save lives is still the motto for right now. If you can.
Yes, it is. Yes, it is. And you know, I think one of the great things is we have a very fine governor and a very fine administration, but we have a governor who's also a doctor. And that's pretty unique. And he was a good doctor too, or is a good doctor. And so I think, you know, that being the case, I think we'll get very good direction and guidance if we can all just be patient.
Awesome. Tempest?
All right. So we have a question from Keisha Ireland. What about mental health needs? What is the plan for those that may suffer from PTSD as a result of the epidemic?
Well, I know that newly appointed chair of the Behavioral Health Subcommittee of the Health, Welfare, and Institutions Committee, I have been in close contact with some of the industry folks that are definitely acknowledging an increase in need for those with behavioral and mental health needs. Make sure you reach out to your providers. Even if you can't get into the office, a lot of people have telemedicine options that are available, but also the governor announced today a $2 million grant that will help the CSBs as it pertains to behavioral health issues. I do believe, unfortunately, it will take us quite some time to see the full impact that this pandemic is going to have on the mental health realm. But if you are a praying person, or if you send positive energy through the universe, send that to our healthcare workers, our first responders, because they are being taxed beyond, I think, what should be expected of humans. And so I'm going to call them superheroes because you guys really are seeing a lot and dealing with a lot. There's a lot of loss. There's a lot of inability to fully grieve loss because of us having to be socially distancing. So on the tab on my website where you'll see Dr. Julian's face and it has health department information, there's also a section that says stress and coping during the pandemic that has the suicide prevention hotline. It also has a hotline that you can click on to get some of the resources. The governor also spoke out about substance abuse and how that could be impacted by the stress that is the pandemic. And so not to make light of anything, but like, I'm an extrovert, and not only am I staying at home, I'm on self-quarantine right now coming from that session. Trust me, from those that were dealing with behavioral or mental health issues or concerns before, you might have new ones now because this is something that you've never experienced. There is no stigma to that. There is no, like, we're not supposed to be okay with this, y'all. Like, we're supposed to have human contact. We're supposed to be able to see our family and our loved ones. We're supposed to hug new babies and all of that. So there is no stigma to your seeking help for anything that you may be feeling from before or that's new. So I just want to put that out there. And there's a domestic violence hotline we'll put up there. There's opioid and substance use disorder resources that we can have that we will put on the website as well. But bottom line, utilize the resources that are available to you. And if you don't know where they are, you can reach out to any of us to try to get you connected. Does anybody have anything to add to that?
That's well said.
Delegate Price, I'll just add that we're also concerned about trauma for our youth, especially thinking about coming back to school and anxieties that our staff may face if and when schools open again. And so that recovery task force that I mentioned, when we gave them the charge, we've asked them to think about academic equity in this issue, which we've talked a lot about today. We've asked them to think about financial recovery. We've asked them to think about student support, but we've also asked them to think about the social and emotional health of our students. I think the most important thing when our students return to school and everybody's health and bringing back that safety net of our schools.
Awesome.
Now, Dr. Lane, I understand one of the reasons we're pushing for covering revenue losses in state and local is what it does to the education budget. Did I understand that counselors were a victim of the budget cuts too?
Yes, sir. In the budget last week, the governor suspended several funding lines, and that essentially allows the General Assembly to come back if a special session is called and determine based on revenues whether those funds could come back. But the school counselor line was reduced completely.
So just
not reduced completely. The new funding for school counselors was reduced and went back to the ratios of FY20. So
the governor,
basically you'll be able to go ahead, Delegate Price. Sorry.
No, I was just gonna make sure, because I know my phone was about to jump off with that, just to make sure there was a lot of great things that we passed in the 2020 session, and the term is unallotted. They were unallotted, basically pressing pause. But I do need everyone that was happy about that that measure that passed to pay special attention for when we do go back into a special session on the budget, to make sure that you are very vocal that that is a priority you want to make sure does show back up. Because as we unallotted, if we're going back with less money, there are going to be some cuts. And so we appreciate hearing from all of your folks, Dr. Lane, that this is something that you want to keep so that there's political pressure for us to keep it.
Well, I think it just it points to the importance of getting federal funding to help state and local budgets on their revenue shortfalls, and all the states are suffering the same thing. If we can get the revenue money back to where it was with federal support, then those kinds of cuts can be restored.
Yeah, and I think the best way, just to summarize this for those listening, is that we were going to hire a lot of new counselors in Virginia. The new positions were reduced, but no school should be facing a state funding cut in the school counselor line item. And then again, Congressman Scott referenced the money coming down to schools. The Secretary of the U.S. Department of Education released the application for those funds on Thursday. Virginia applied on Friday. And so hopefully that gets approved in the next few days, and we will be sending that money directly to your school divisions to support their efforts.
Efficiency. Yay.
Yep.
Tempest, any other questions?
Nope, that's it on my end.
Awesome. Is there anything that anyone is like, oops, I forgot to say it and I want to get it out in a closing statement?
Yeah, I do. I just want to, everybody's struggling right now, and people who are in need of food, the Virginia Peninsula Food Bank's website is hrfoodbank.org, and they are doing partnering with churches and groups to host mobile food pantries. So we're going to make sure that people have sufficient food, and just realize that this virus is not no city limits. So this is why your state, local, and national are all working together, as illustrated tonight, all trying to help solve this problem. So just want to make sure people stay home still, stay safe, don't risk your health or the health of your family and the health of our first responders. And we also want to, again, praise our first responders.
Thank you. Anyone else? Congressman Scott, you don't have anything else?
I've been talking during the whole program. I just want to thank you for bringing us together. This is an excellent conversation. And you see the different levels that we're working on: mental health, economy, education, healthcare. There are a lot of different aspects. Everybody's working together to try to get us through it.
Awesome. Well, I definitely want to thank everyone. We had Dr. Julian from the Peninsula Health District with Virginia Department of Health. We had Congressman Bobby Scott from the 3rd Congressional District, Mayor McKinley Price from Newport News, Dr. Megan Healy, I wrote it down, Chief Workforce Development Advisor to Governor Ralph Northam. We had Dr. Fisher, the Vice President of Medical Affairs from CarePlex Hospital, Kapua Conley, who was with us, the President of Sentara CarePlex Hospital, and State Superintendent Dr. James Lane. We answered a lot of questions, but there might be some more questions. And so what we'll do is we'll upload this to my website. We'll also have links to all of them and their emails or their departments, along with some of the information that they mentioned tonight. And then we'll make sure that we continue to upload those resource links on the website, and we'll drop the link on how to get those absentee ballots. Don't forget, request your absentee ballot by May 12th in order to vote on the election that is now currently held on May 19th. Thank you all so much for watching. And again, thank you all for joining us. Everyone have a good night.